let's start with some introductions. So do you want to start?
Yeah.
Yeah.
Right. So I'm Will. I am a GP. I've been a doctor for about 11 years now, and I've been a GP for 5. I work 3 days a week in the NHS as a GP. I do half a day doing an outreach clinic for homeless people, and then I've just started a private practice of lifestyle medicine, which is 1 day a week as well. And my interests are basically in that more prevention and treatment of things in a holistic way than trying to treat things when they become disease or they become illness. And that's what I really want to concentrate on for the next few years is trying to give people the tools to do things themselves. And I think that's how we basically came together, because you are also dealing with like self-care, and specifically with yourself with mental health, and that's how we kind of linked up, really, wasn't it, Joe?
Yeah.
That kind of thing.
Yeah, no, thanks for that one. That was a really good introduction. So following on from that, I'm Joe. I'm an occupational therapist by profession. So I'm about 9 years qualified now as an occupational therapist. Seems like a lifetime ago.
Yeah.
So my current week, I locum for Cheshire East Council. I do that 4 days a week, and that's in major adaptations, moving and handling. But I work with a lot of people with life-limiting conditions. So that can be anything from motor neurons disease, right through to depression. So my role, obviously, within that is not only looking at the physical aspects of things, but also the mental health aspect of things, and ensuring that I can increase that person's level of independence. And then on the other days, so on a Monday and a Saturday, I do mental health coaching. So I incorporate my own experience as an occupational therapist. I do some CBT, some acceptance and commitment therapy, and I've recently started incorporating neuroplasticity as well, which is all around rewiring the brain. My specialities are in general anxiety disorders. As I say, I've worked with a lot of people with life-limiting conditions, so there is a lot of coaching around that as well, around acceptance. I want people to live as long as they can, really. And obviously, I'm somebody that's suffered with health anxiety myself. So there's a lot of lived experience there. So I'm hoping people can relate to that. So over the next few years, I'll be hopefully doing a lot more posts on social media, but we'll be doing lots of these podcasts and work together with Will around lifestyle and working that alongside mental health. So there'll be a lot of talk around exercise, the benefits of exercise, diet. We talk a lot about that, and brain rewiring. So that's me. So do you want me to kickstart? Do you want me to just sort of say what we're going to... So this is our first podcast together today. So please excuse us if it's a little bit rusty. It will get better. So I probably missed a bit. I did work for the NHS for 4 years. So we're going to talk today about the limitations within the NHS. Hence why we've kind of broke off and we're trying to do our own thing. So do you want to kickstart, Will, a little bit about how you found things?
I think so. And I think the first thing today to do is praise what the NHS is, which is free at the point of care for whoever needs it, because that isn't available for everyone in the world. And I work in human moss side, and there are people there who just wouldn't be able to afford anything unless it was free at the point of care. And so it is something that was set up and works very well for certain things. The issue is that it's set up for treating disease, and it is very thinly spread. And a lot of the structures are from past times when there was less demand on the service, because people weren't living as longer. The science behind medicine wasn't as good, so there wasn't as many treatments, there wasn't as many diagnoses, and people didn't go to the doctor quite as much. And so that structure is kind of bending at this point in time. And what that means is that some people who need the kind of things that we're going to talk about over the next few weeks and months find it very difficult to access the right type of care. And that's the first thing, is that I'm a GP. I appreciate that sometimes it's very difficult to access a GP appointment. And there's lots of sort of subspecialties that you'll get sent over to you first before you actually get to speak to a doctor. I think in comparison to mental health services, a GP is probably best help to manage some of these things that Joe's talked about, like your anxiety, depression, where it's potentially at a point where you're still functioning to the naked eye, but what's going on inside your head and the other symptoms that can be related to these kind of things are bubbling underneath, and actually you're really struggling, rather than something like schizophrenia or bipolar, which is better managed by a psychiatrist. So we see a lot of the kind of stuff that we're going to be talking about over the coming weeks. As I said before, I think the NHS focus on illness rather than longevity, health optimization, and managing yourself. I think there's a problem sometimes with continuity. And I know that, Joe, we've talked about before, especially talking about therapy, that actually one of the most important parts of therapy is the therapist and the trust that you have with the therapist and the relationship that you have with the therapist. And it used to be that you used to have a family doctor and you used to go and see them all the time. And again, because of issues with the strain on the NHS, that just isn't possible nowadays. Waiting times are an issue. So you'll get a good amount of therapy, 8 to 12 sessions sometimes, quite regularly on the NHS, but you'll be waiting 5 or 6 months in central Manchester for that, and things can spiral. And I think generally there's a newer way of looking at things that is more holistic, that maybe medicine as a sort of traditional medicine isn't made up for. So they think about sort of illness, they think about the biomedical aspect of things rather than looking at things holistically. Those are the kind of things that come to mind. I think if you're acutely unwell, it's fantastic. If you're really unwell, it's fantastic. But it's some people get caught between the cracks and feel very alone and feel very lost. And so in terms of mental health, I would say that those are some of the limitations. I know I've just given you a monologue, but they're the kind of things that come to mind when you ask that question.
Yeah, no, that's great. And obviously, first of all, I'd just like to say, you do great work, brilliant, all the GPs out there and OTs, just kind of singing the same hymn sheet. Sorry, really, there's a lot of limitations, within the NHS, but it's not because of the worker, it's coming from above, really, isn't it? I mean, if I look back at my own personal journey, which probably stretched back to 2021, I think. That's probably when I first had my, let's call it, real meltdown. And it probably took me 4 weeks before I actually wanted to reach out and get help. I think being an OT at the time, I felt a bit, I don't know, I felt a bit like I should know this stuff. I shouldn't need to ask for help. I should, I felt, it's really hard to describe, but I think there was an element of weakness there, I'd say, and fear, as I say. And when I did reach out for help, it probably was, it was about a 6-month wait, I think. And I think at that point, I really needed some help. I didn't quite know where to turn. And I was referred for some talking therapies. But, they said I needed a little bit more. So we wanted to look at the traditional approach, which is CBT, which tends to be, doesn't it, the go-to,
Yeah.
in the NHS. And I said, I did have CBT years ago, but I think the reason it didn't work was I've probably got more. Well, I've got more insight these days. I'm a lot more self-aware.
Mm-hmm.
I think that's probably where people struggle. It's not having that insight, that self-awareness, and I'm a big advocate for medication because I think there is a place there for it. But as I've talked to you before about it, it's when we talk about antidepressants, it should be used as a tool, amongst other things really. So I actually had a letter. They said they'd sent me a letter, which I didn't receive. So then I was taken off the waiting list, and then had to re-refer, and we were looking at another 6 months. So I thought, well, I can't wait 6 months. And fortunately, I did have the money to go privately. And, I went then and I started studying acceptance and commitment therapy, which I will talk more about over the coming weeks and months. It's one of the tools that I use with my clients, but it really did, transform my way of thinking, in terms of allowing anxiety to just be there, not to fight it. It's something that we'll all have to sort of manage for the rest of our lives because of the situations we're dealt with. So it's just a shame that things are changing because we used to have a family doctor growing up, and it was great just to get that continuity of care. And I think the waiting lists are getting larger, aren't they? I certainly see it, within my role. And patients get frustrated with us, but it's kind of not our fault, is it? So it's I think the way we're going to go with this is I really want people to gain more insight into their own needs, and we kind of from my point of view, I kind of want to give them the tools so that they can use them for the rest of their lives. And so you got anything to add to that, Will?
I think I think there is support out there, and there are good community groups as well that you can find. But you really do have to search for it sometimes. And what is available on the NHS is there, but it's there after a bit of a wait, and it's there for a short period of time. And so you do get that support if you are really, really struggling and feeling hopeless and just spiraling out of control. But once you start to get better, what you do need to put into place is your own self-care and your own way of managing things, whatever that be. And I'm sure we'll talk about loads and loads of that stuff over the coming weeks. Because if not, you'll just keep bouncing back and forth to these things.
You will.
Sorry. No, there is a point where there is the support out there, and there are people formally to help you, but you do really need to help yourself as well. And it's about education and how do you do that? And as you say, that's what one of the reasons why we're doing this is, hopefully to give people that education so they can help.
We want to make more awareness, and and I think as well, probably if why people find practices like talking therapy, CBT, difficult, or that they've not worked for them. Again, it's more than likely they haven't met the right therapist or the right person. They've not had that connection. It's the same when I'm sure you've had it during your career. You'll have people patients that'll ask can I see yourself? I always get it. I'll get a referral, and it'll come through like where I do the locum work. They've asked for you personally because they like the way you are and stuff, and that's really important, especially I think from when I've had therapy in the past. When I've found it has been really beneficial is when I've had the connection with that therapist. But I agree, you do need a robust treatment plan. Always go and speak to your GP first, obviously. And then you need a plan really, which we will touch more on. if you're taking antidepressants, that's great. Exercise, nutrition. There's a million things you can do, can't to work alongside what you're actually doing now.
Yeah.
Yeah.
And I think it all starts with like the acceptance that you need some level of help, or you need to look somewhere because the way that your life is going at the moment isn't working. And sometimes one of the things that we do see as GPs is that someone will come into the practice feeling quite helpless, and it's just that. I mean, and one of the other things is you get 15 minutes with your GP basically.
Yeah.
But that 15 minutes of just sort of outpouring of all of this pressure that's happened, and speaking to someone and just sort of accepting that something needs to change can be a massive sort of springboard into feeling better. And so it is that initial, actually something is wrong here, and seeing your GP or speaking to your friends and family about it in order to come up with a plan also needs to happen. And so that's why going to your GP can be that boost that you need. But then you may only see your GP every month or two. And so what do you do in between that time is a lot of on you, because they'll talk about antidepressants and maybe that can give you a bit of a boost and make everything else easier. And then you've got the therapy further down the line. But then you're with yourself for 16 hours of the day when you're awake. And it's what you do with that and the habits that you form that are actually the most important thing.
I actually think as well, it's good to have some time off work because you need that period early on to make the plan. And at that point, the anxiety is probably at its worst. But as we talked about, on the antidepressants, they will, they do take the edge off things to help you do the other work. But taking some time off work is good. But it's also good to get back to work because well, obviously we talked about this before ourselves, didn't we, about managing burnout, that it's important that I'm having a holiday this week. You've talked about taking some time off, but also when you do return back to work, it's important that you manage your stress levels, which, you can talk to your therapist about this, because there might be some work that you need to do around assertiveness, agreeing to things or declining requests, we've seen that in our careers. It's your workloads can be excessive, so it's also managing that as well, depending on what your role is, for sure. Yeah, have you got anything else to add?
Yeah, I mean, so purpose is massively important and work can be massively part of that. I would say that purpose is almost more important than happiness in terms of like wellness and how you go through your life in a good way. Work can be a big distraction if things are going wrong in your life. It can give you that purpose. If work is the main stressor in your life, then maybe you do need to take some time off. And part of the plan of coming back is, are you going to have a discussion with occupational health or your line manager or HR about how things can change? Because that's the big thing, is that like you have to understand that whatever you're doing with your life at the moment isn't working. So change needs to happen, which can be really scary and can be one of the reasons why people don't look for help and don't make these new habits, is because it can be quite scary.
I agree.
Yeah. So it can be a good or a bad thing, but having a couple of weeks or 4 weeks off at the start maybe will set you up to sort of like push on.
Yeah, for the longevity. And I think people probably do get scared early on as well, because they think they have to change every last little thing, whether that's work, the relationship, their exercise route, everything really. But I always say, don't jump before you can walk. Small little steps. I think it's like I'll just touch on what you said about work. If work is the main stressor, that's your starting point, really, isn't it? Or if relationships are always difficult, obviously, but that can be approached once you reduce your third stress level. But it's really difficult, I think, as well. But I think, like you said, it's speaking to family, speaking to close friends, accepting that things are difficult right now,
Yeah.
and I think that sets you on the path really. And
Mhm.
you are, if you're determined and you believe that you can recover, then you will.
Yeah.
You will. And setbacks are normal, aren't they? You can
Yeah.
have setbacks. It would be great if we could go through life without any stresses or setbacks, but unfortunately we can't. So, like you said,
Mm.
if you can. I always say if you can build your, I don't know, your tool bag, and you've got all of these tools in here.
Yeah.
Some weeks are going to be great, some weeks are going to be bad, but if you can build your own tool set, you've got that for life, then, haven't you?
Yeah, and I think that was the point of this first podcast, just to know that like the NHS has these things out there for you that can
Yeah.
help, but you also have to rely on yourself,
Yeah.
and that can be very difficult. And whilst that's happening, you also need to be very kind to yourself, because there is a lot of self-stigma, as you described with yourself. You took 4 weeks before you looked for help,
Yeah.
and that is a problem. And you, as I say, you're unwell at the moment. You're making progress. You have the tools, or you're learning to, create the tools to get better. And within that process, you just have to be kind to yourself. I think that's a massive important thing as well.
But it's always a good starting point, isn't it? I'd say, obviously have a chat with your GP, speak to your friends and family. There are services there. Like I said, I speak to a lot of people that say that CBT hasn't worked for them, but again, I think it's very good. I just think it just depends on the therapist, and
Yeah.
maybe you just weren't quite ready yet. Maybe you needed. This is just exaggeration. 6 months of just talking therapies,
Mhm.
and then you're ready then to change the way you think and stuff. So
Yeah.
it's a bit of a journey, but there is availability within the NHS. Obviously, we'd like continuity to be a bit better, but fortunately,
Yeah.
it's not these days, is it? But
No.
so
No.
anything else to touch on? You think limitations wise, make people aware?
No, I don't think so. I think the other thing that you have to kind of understand is, I mean, if you had all the money in the world, you could speak to a therapist every day. You could have a life coach who could speak to you every day, and you could have like a PT and all of this stuff. Like if money wasn't an option, but that's very rare for people.
Yeah.
The NHS is something that is free. I know you pay your taxes, but it is limited because it needs to be spread around everyone. And so what I would hope that we can sort of talk about and teach people is that there are other options whilst you wait, or to use alongside.
Yeah.
That's what I would hope the point of this is.
Absolutely, yeah. Kind of like a bit of a step by step, as if you're, we want to speak to you, the audience, so you can really, you can take something away from what we are talking about for your own journey, really, because it's not easy sometimes when you're looking for answers and you're scanning through social media. That could be because you are scared of your symptoms, or you're looking for answers, and that I just want to validate that is scary. But then finding the right person that speaks to you. Well, that's what